As you know, the healthcare system has been in the news recently, and I've seen a couple of your posts and your reactions as well. So, just regarding the shooting of the United Healthcare CEO, it shocked so many people. And were you surprised by the public response online to the incident?
Initially, I was a little bit shocked by the public response because it came across my social media. I don't consume news channels or radio. So if it doesn't come across my social media, I basically don't know that it happened. So I'm scrolling my social media and I see a post about the CEO of United Healthcare being gunned down in Midtown Manhattan. And then I clicked on the comments, as we frequently do, and people were like making jokes. And they were saying like, oh, I would like to have sympathy, but my claim has been denied. Or did he have prior authorization for that? And, like a lot of the insurance terminology. And I thought, like, how callous and how vile of our society that a man who presumably has a family and children was just gunned down in broad daylight in the middle of the New York City, and you're making jokes about it. But then I dug a little bit deeper on the practices of the company and how they like to deny and withhold life-saving treatment from people. And I thought, oh, the people are mad. That's what this is.
Yeah, I think it's almost people are comparing it to like the Joker, where it's vigilante justice happening for a lot of the people in health insurance who've been denied care. And I'm wondering, as a medical practitioner yourself, are you sympathetic to a lot of those commenters or those people online?
I do now understand where they are coming from. Actually, in the last week, I did a lot of research about how healthcare insurance, how insurance works in our healthcare system. And I was really surprised to find out how much the executives of these insurance companies are paid. I had no idea it was that much. Like $20 million we're talking about for one person per year, which is ridiculous. But they're denying claims for life saving or life improving care for patients, surgeries, procedures, medications, and then basically lining their own pockets with that. And you have to wonder, why is the United States, out of all the developed countries of the world, the highest in per capita expenditure on healthcare, but we have some of the worst healthcare outcomes ever?
Okay, so that's interesting because you, as a doctor for, I mean, how many years? Um, you actually didn't really know the health insurance system or their business practices up until recently. Is how much transparency is there between the health insurers and the doctors?
Oh, not at all. I mean, especially for my job, because my job in particular, I work at an academic institution. And so I go to the hospital and put the people to sleep who are on my schedule. I don't know what kind of insurance they have. I don't know if they are insured. Some of them may be undocumented. None of that is my business, actually, because when I go to work, my business is to take care of the patient the best that I can while they're having surgery or having a baby.
So
It doesn't even factor into my brain when I'm taking care of a patient, like, oh, I wonder if they have insurance, I wonder if I'm going to get reimbursed for this. But that's not true of many doctors. That's not true of the vast majority of doctors that work in this country. And you have to come to the realization that people are incentivized by money. And that's why when you call a doctor's office to make an appointment, let's say you have a rash or your back hurts, and you call some doctor that you find, I'd like to make an appointment with Dr. Smith. What is the first question the receptionist asks you when you say you'd like to make an appointment? It
do
is
you
not,
have insurance?
what is your problem, or where does it hurt, or how long has this been going on? The first question the reception asks you is, what kind of insurance do you have? And if you have Medicare or Medicaid, guess what? The next available appointment is like 8 months away. I'm not even lying. If you have some HMO and not a PPO, the next appointment is several months away. I have a PPO and I hadn't gotten a pap smear in over a year, pardon me. And I called my OBGYN to get an insurance to have a well woman examine a pap smear. And she told me I could be seen in 6 months. And I have the quote unquote good insurance. And I'm like, hell, I'd hate to have bad insurance. I'd probably die before I got seen for something. And people are living with conditions that are painful and are decreasing their quality of life. And the first question you want to ask them is what kind of insurance they have. Something is terribly wrong with this country.
Okay, so a lot of people online have been targeting their anger towards the medical system at large, not just the health insurance companies. I've seen a lot of comments go against even doctors, even anesthesiologists. Um, you know, there's also been the claim that health insurance companies feel like doctors are overcharging, and that's why they are limiting some of, for example, the anesthesia law that you talked about on your Instagram. What is your response to that?
By and large, most doctors are not in cahoots with the insurance company. In fact, I would dare to say that we are adversaries. I
Mm.
say this because many of my best friends work in primary care. And as an internal medicine doctor or a pediatrician, you have a patient which you've deemed needs something. A study, a procedure, a medication, whatever it is, you have all this medical training and you've decided your patient needs this thing. And then you prescribe that or schedule that for your patient, and your patient calls your office back and says, my insurance denied it. Now you got to write a letter saying that you tried this, that, and the other thing first, and that failed for 6 months, and then maybe I can have this thing. And they just put so many layers of complexity and extra testing and trying things that you know aren't going to work. Because guess what? You've been a doctor for 20 years and you know that that thing doesn't work. But the insurance company dictates what you have to do, and they dictate the care ultimately that we're able to provide for our patients because they're the ones paying for it. And so my friends in primary care are absolutely fed up with insurance, and actually it's cited as one of the top reasons for physician burnout in the United States is dealing with insurance companies. So we are not on the same side of the playing field there.
So, how much does the cost of care account for the actual diagnosis of the patient?
I read in some studies that physicians and clinics are paid 20% of healthcare expenditures, and over a third goes to administrative costs. So I would count that the $20 million salary that the CEOs are getting. And there's just so many layers of complexity with healthcare when there doesn't need to be. You know, sometimes things in life need to be complex for a reason. This does not. They add in so much extra stuff and complicate matters and frustrate patients, and you have to jump through all these hoops. That's why the American people are upset. That's why some of the comments on the social media posts are very callous, because the American people are smart and they're seeing what's happening here.
Now, in your practice personally, have you ever, I know you're an anesthesiologist, so you don't have the right or not right to deny care to someone or misdiagnose because, you're basically, your time is billed based on how long the surgery takes with the surgeon or how long the procedure takes. But have you seen any of your colleagues or even in surgery where someone's care has been either compromised or shortened or maybe even misdiagnosed because of the pressure from an insurance company?
No, I have not. Thank God. I have not ever seen a doctor provide substandard care to a patient because time had gone long or the patient had complicated anatomy or any of it. When I'm in the operating room, everyone in that operating room is doing whatever it takes to give the patient the best care possible. And that stupid rule with Anthem Blue Cross Blue Shield that they ended up retracting, that was the stupidest thing I had ever heard of. That after a arbitrary time of surgery, if you went over, that they were not going to pay the anesthesiologist. I'm like, did anyone think about this or say it out loud or run it by a few friends before they decided to actually roll out this policy, because it's the most asinine thing I'd ever heard. But thank God it was retracted, and hopefully they got enough feedback from doctors and patients that that's not the way we're going to do things.
Everyone has stories about how insurance companies have given their mom the runaround about getting, a shot instead of a surgery, or putting someone on a drug before doing a procedure that they might need. Now, in your knowledge, is there any oversight by any government body or any authority that can determine or guide a lot of these insurance companies who make the denials or the okays for these type of procedures?
I'm not specifically aware of any governmental agency that oversees the decisions that are being made by these private companies. I'm not sure, if there is such a organization, but I think the insurance companies literally are just doing whatever they want.
God, that's such a scary predicament because, you know, what is a common person to do in this environment? Like, in your experience, what is the best insurance for someone to get? Or is it better to be at a HMO or a PPO? Like, what would you suggest for just the everyday person?
Well, I mean, the best insurance is the one that gives you the most comprehensive care when you need it, right? And you have to remember, people by and large don't want to be using their insurance because that means something's wrong, right? The insurance is really just meant to be a safety net for people when they have bad things happen. And when those bad things happen and the safety net that you have been paying for and thought was going to be there to catch you doesn't, that's when people lose faith in the system, right? And that's what accounts for all these vile comments out there. Um, I, I just think that the people here need to be educated about what's going on. I think, in light of the tragedy of what happened last week, at least we're talking about it now, right? And as far as problems go, they're not going to get better until people start talking about it and understanding. And even myself, I learned so much in the last week about our insurance and how it works in the United States. So I do think that the patient has a role in being their own advocate and being knowledgeable about their insurance policies. But I think there needs to be better government oversight. I think the insurance companies need to be more transparent. And I think they need to put the well-being of their patient as their top priority and not lining the pockets of their CEOs and investors.
Okay, so we were talking about when you go into a doctor's office and you basically have, at least my experiences, I go see a doctor and they give me two prices. There's the with insurance price and there's the uninsured price. And I don't think many people understand the actual mechanical economics between doctors and insurance companies, because a lot of people think doctors make so much money, they're ramping up the costs of healthcare. So, why is my doctor charging $5,000 for this one procedure when if you're off health insurance, it may cost only $2,000? Can you pull back the curtain a little bit and share with us how actually just a doctor gets paid by an insurance company?
That's so complex that I probably can't even pull back the curtain all the way, but I can give you a little sneak peek. The without insurance, which is the cash pay option, is much cheaper than the insurance option because that's just like a single transaction. Like, you want this endoscopy, it's $2,000. But then with insurance, it's frequently more. But what you don't know is behind the scenes, the insurance company has contracted with that hospital or with that provider to pay a certain amount. So I swallowed a fishbone and was in the emergency room not too long ago getting an endoscopy to fetch the fishbone out of my esophagus so that it wouldn't puncture me and I'd get septic and die. And I got the bill afterwards from my emergency department visit, and it was very enlightening. You can charge whatever you want to charge. It doesn't matter. You can charge $100,000, but then you're only contracted to be paid X amount. So it's like they charge 2,000 and then they're like, but the final was only 400. And it's crazy. Like the numbers make no sense. They're not listed anywhere. There's no transparency. They make it so confusing that you kind of just look at it and shrug your shoulders. I paid my, I don't know, $200 ER copayment. And then I paid the gastroenterologist who did the endoscopy to fetch the fishbone out. I paid the anesthesiologist and the CRNA who were there doing the general anesthetic for that. And then I paid the hospital to be admitted and have IV fluids and all that kind of stuff. So just my one little visit to the emergency room, I had like 6 different hospital bills that I was paying, and I didn't even fully understand what was going on where. So there needs to be more clarity, transparency, and honesty.
So if I get a $10,000 medical bill from a doctor, from say one of your surgeons, and you did the anesthesia, how much of that actually goes to the doctor and how much of that goes to the insurance?
I'm sure that it varies on a case by case basis, but if you held a gun to my head, I would say 20% probably ends up going to the physician. Or less.
20% or less?
15 or 20%. Yeah. Like if your anesthesia bill was X amount, it has all the medications, equipment, all that stuff. That is not all going to your doctor. Please don't think that that's all going in my pocket. I mean, I'm paid on the very low end of the anesthesia salaries because I choose to work at a teaching hospital that's also mostly serving underserved patients. That's a choice of mine. But even the higher paid anesthesiologists are not getting the majority of the bill that you're paying.
I mean, that's absolutely insane, sounds like, because it sounds like insurance companies are just inflating the price of procedures to get you to pay for that either copay or that high deductible, and then basically overcharge for the rest of the payments in perpetuity to their insured. Is that right?
I have never worked for an insurance company. I have a very rudimentary understanding of how healthcare insurance works, but my understanding as a whole is that their MO is to not pay as many claims as possible. In fact, United Healthcare, I think, denied 30% of the claims that patients submitted to them
Mm.
and use that money to pay their shareholders and their executives. I mean, that is my rudimentary understanding of how things work over there.
Okay, so I want to close this out with hopefully some type of hope. There are, solutions that have been proposed, like a nationalized healthcare system. I know they do that in Europe, in Asia. Even my family, they have the best insurance here, but they still decide and choose to go to either Taiwan or Thailand or other countries to get care, to buy medicine. Do you have any experience with colleagues abroad or anyone with experience with a nationalized healthcare system that have any anecdotes or any stories or experiences in those type of countries and healthcare there?
Yeah, I mean, we need someone way smarter than me to come up with an adequate solution to this problem. But I will say the nationalized healthcare system is not a golden bullet for this issue. The people there, even though it's nationalized and the government pays for it all, they have very long wait times to care, and sometimes can't see a specialist for months and months. So it comes with its own set of challenges as well. I think this needs to be something coming from the government. There needs to be a task force focused on this, and we need to stop pointing fingers at each other and really look at the crux of the problem. Because at the end of the day, despite all this money and all the things that have been in the news, the problem is that the people of America are getting sicker and not getting healthier. We don't spend enough money on preventative care. We spend trillions of dollars on managing chronic diseases that, if we had educated people better, could be avoided, like hypertension, like heart disease, like diabetes, which, like 30% of the population is pre or diabetic. And it's just insane to me how we want to keep people sick in this country and benefit off them being on medications forever. I mean, now we're providing GLP-1 agonists like Wegovy and semaglutide, Ozempic, whatever brand name you want to call it, to like all the diabetics. Our healthcare can't handle that expense. We don't have enough money to pay for Ozempic for everyone. And that's just the people who need it, not the people who are using it just to be skinny. And it's just like, we need to take a look at the bigger problem, which is that we need the people of this country to be healthy and not sick.
I agree with you. It's ridiculous. You see Carl's Jr. ads, McDonald's ads, and then you have insulin prices being higher here than anywhere else in the world. So
I think
what
it's all
are we
a
doing?
conspiracy. I think the food and pharmaceutical companies are in bed with each other. I think they want to keep Americans sick because the most profitable person is someone who has chronic disease and needs medications for life. Hypertension medication, Wegovy or Ozempic, Lipitor, Crestor for your high lipid levels. Like, my patients come to me and they have a list of medications that's 10 medications long. And I'm like, how do you even remember to take them all? Or do you just put a handful in your mouth and wash it all down? It's crazy. We need to focus more on education, preventative care, eating healthy, all the boring shit that no one wants to talk about, because those are not sexy topics. But that's what's going to make America healthy.
Dr. Moon, I think you hit the nail right on the head. I know I'm calling you Dr. Moon, but it's true. The lack of transparency, the price gouging, the crazy overcharging of the insurance companies. That's why I think a national option might be the right choice, because at least it would keep pricing in line, and then create then a private option that could not overcharge outrageously because there is a national option. But I really want to thank you for taking time out of your day. I know it's a really hot topic, and a lot of heat is getting thrown the doctor's way. So thank you so much for coming, and we'll talk soon. Thank you.